The silent epidemic, unmasking the health crisis facing black women in America. Welcome to the Black CEO podcast. Today we have the extraordinary privilege of sharing insights from our recent interview with Rashanda Mack, a true visionary and relentless warrior in the fight for health equity for black women. Rashanda's groundbreaking work and unwavering passion have not only shed light on a critical issue affecting millions, but have also ignited a movement that's reshaping the landscape of healthcare in America. Her dedication to making the world a more just and equitable place is nothing short of revolutionary. Ladies and gentlemen, fasten your seatbelts. We're about to embark on a journey that will challenge everything you thought you knew about healthcare in America, a journey that will make you question, make you angry, and ultimately, I hope, inspire you to action. Have you ever wondered why, in a country that boasts about having the most advanced medical technology in the world, some communities still struggle to access basic health care? Why is it that in the land of the free and the home of the brave, the color of your skin can determine whether you live or die? These aren't just rhetorical questions, my friends. They're matters of life and death, of justice and injustice, of a society that trumpets equality from the rooftops but fails miserably to deliver it where it matters most, in our hospitals, clinics, and doctors' offices. Today, we're diving headfirst into the turbulent waters of health equity for black women. It's a topic that's not just important, it's urgent, it's critical, and it's long overdue. This conversation has the power to change lives, save lives, and fundamentally reshape our understanding of what true healthcare means in America. Imagine for a moment that you're a black woman living in the United States. You're educated, you have a good job, you take care of yourself, you eat your veggies, hit the gym, and even splurge on that overpriced organic kale smoothie every now and then. But every time you step into a doctor's office, you can't shake this nagging feeling. It's like a persistent itch you can't quite reach, a whisper in the back of your mind telling you that something's not quite right. You see, you've heard the stories of women who look like you being dismissed, misdiagnosed, or treated as if their symptoms were all in their head. You've read the statistics, cold, hard numbers that confirm your worst fears. And let me tell you, those numbers are enough to make your blood run cold. Did you know that black women in America are 3 to 4 times more likely to die from pregnancy related causes than white women? That's right. In the 21st century, in one of the wealthiest nations on earth, black women are dying in childbirth at rates comparable to some developing countries. But wait, there's more. Black women have higher rates of many types of cancer and are more likely to die from heart disease. Now, I know what some of you might be thinking, but surely these are just numbers, right? Statistics can be manipulated, data can be skewed. Well, let me put it this way. These aren't just numbers on a page. They're mothers who never got to hold their babies. They're daughters who left grieving parents behind. They're sisters, friends, leaders, nurturers, lives cut short, families left in shambles, communities robbed of their pillars of strength. But why? Why does this disparity exist in a country that prides itself on having some of the best healthcare in the world? The answer, as Rashanda Mack so eloquently puts it, is as complex as it is infuriating. It's a toxic cocktail of systemic racism, unconscious bias in healthcare, socio-economic factors, and a medical system that too often fails to recognize and address the unique health challenges faced by black women. Let's break this down, shall we? First up, we have the issue of access. Many black women live in areas with limited healthcare facilities. It's like trying to find a vegetarian option at a steakhouse. Theoretically possible, but practically impossible. Or they work jobs that don't provide adequate health insurance. Because apparently, in America, your ability to not die from a treatable illness is directly tied to your employment status. Makes perfect sense, right? But here's the kicker. Even when black women do have access to healthcare, they face another, more insidious barrier: bias. Studies have shown that medical professionals often underestimate the pain of black patients, leading to inadequate treatment. It's as if there's some unwritten rule that melanin acts as a natural painkiller. Spoiler alert, it doesn't. And let's not forget about the lack of representation in medical research. Historically, clinical trials have not included enough black participants, leading to treatments that may not be as effective for black patients. It's like developing a one size fits all shoe and then being surprised when it doesn't fit everyone. Shocking, I know. But it goes even deeper than that. The stress of living in a society marked by racial discrimination takes a physical toll. Researchers call it weathering, the idea that the constant stress of racism causes Black Americans to age faster on a cellular level. This stress contributes to higher rates of conditions like hypertension and diabetes. It's as if racism isn't content with just attacking the mind and spirit. It has to go after the body too. Now I can almost hear the collective sigh of despair. This is terrible, you're thinking, but what can we possibly do about it? And that, my friends, is where Rashanda Mack's work becomes so crucial. She's not just highlighting the problem, she's actively working on solutions. And these solutions start with awareness and education. One of the most powerful tools we have is information. Black women need to be armed with knowledge about their health risks, about the questions to ask their doctors, about the symptoms to watch out for. But it's not just about individual knowledge, it's about changing the system from the ground up. Rashanda emphasizes the importance of diversity in healthcare. We need more Black doctors, nurses, and medical researchers. We need healthcare providers who understand the unique challenges faced by Black women, who can recognize symptoms that might present differently in Black patients, who can communicate effectively and build trust. Because let's face it, it's hard to trust the system that has historically treated you as a second class citizen. But let's be crystal clear about something. This isn't just a Black issue, this is an American issue. When a significant portion of our population is receiving substandard health care, it affects all of us. It weakens our communities, our economy, our national well being. Achieving health equity for Black women isn't just the right thing to do morally, it's essential for the health of our entire society. So, what can we do? How can we be part of the solution? Rashanda offers several actionable steps, and I'm going to share them with you now. Consider this your call to action, your marching orders in the fight for health equity. First, educate yourself. Learn about the health disparities facing Black women. And no, watching Grey's Anatomy doesn't count as medical education. Read reputable sources, listen to experts like Rashanda, and most importantly, listen to Black women when they share their experiences. Then, share this information with others. Be that annoying friend who always brings up systemic racism at dinner parties. Trust me, it's more important than discussing the latest reality TV drama. Second, advocate. Speak up when you see disparities. Support organizations working towards health equity. Push for policies that address systemic racism in healthcare. Vote for leaders who prioritize this issue. And if you can't find leaders who prioritize this issue, become that leader. Run for office. Be the change you want to see in the world, as the saying goes. Third, if you're in healthcare, examine your own biases. Are you really listening to all your patients equally? Are you staying up to date on how conditions might present differently in Black patients? Are you advocating for more inclusive medical research? If the answer to any of these questions is no, it's time for some serious self-reflection. Fourth, support Black women in your life. Encourage them to prioritize their health, to seek second opinions if they feel they're not being heard, to advocate for themselves in medical settings, be their ally, their cheerleader, their backup. And finally, remember that this is a marathon, not a sprint. Achieving true health equity will take time, effort, and persistence. But every step forward, every life improved or saved is worth it. We're in this for the long haul, folks. Now, I want to share a story that Rashanda told during our interview. It's a story that illustrates just how critical this issue is and how even seemingly small acts of advocacy can make a world of difference. She spoke about a young Black woman named Tasha. Tasha was 28, successful in her career, and seemed to be in perfect health. Picture the kind of woman you see on a magazine cover, vibrant, full of life, with a smile that could light up a room. But beneath that picture perfect exterior, something wasn't right. Tasha had been feeling unusually tired. We're not talking about the kind of tired you feel after binge watching your favorite show until 3 a.m. This was bone deep exhaustion, the kind that makes even getting out of bed feel like climbing Mount Everest. She had also noticed some unexplained weight gain. Now, we've all had those months where we've indulged a bit too much in comfort food, but this was different. Tasha was gaining weight despite not changing her diet or exercise routine. Concerned, Tasha did what any responsible adult would do. She went to her doctor. But here's where things took a turn. Her doctor, a middle aged white man who had probably been practicing medicine since before Tasha was born, dismissed her concerns. He told her she was probably just stressed from work and needed a diet. Case closed. Next patient, please. But Tasha knew something wasn't right. She could feel it in her bones, in the way her body seemed to be working against her. So she did something that unfortunately is all too rare. She pushed back. She advocated for herself. She demanded more tests, even when her doctor seemed reluctant. And you know what? Tasha was right. After running those tests, she was diagnosed with a thyroid condition, one that, left untreated, could have led to serious complications. We're talking heart problems, fertility issues, even mental health challenges. Tasha's story had a happy ending because she advocated for herself. She refused to be silenced, refused to accept that her concerns weren't valid. But how many women don't? How many are dismissed, their concerns minimized, their health jeopardized? How many Tashas are out there right now feeling that something's wrong, but being told it's all in their head? This is why Rashanda's work is so important. This is why we need to talk about health equity for Black women, because every Tasha deserves to be heard, to be treated with respect, to receive the best possible care. Every Black woman deserves to walk into a doctor's office and feel confident that her concerns will be taken seriously, that her pain will be believed, that her life will be valued. But Tasha's story is just one of many. Let me share another story with you, one that Rashanda encountered in her work. This one doesn't have such a happy ending, and I warn you, it's not easy to hear, but it's a story we need to listen to, a reality we need to face. Meet Aisha, a 35-year-old Black woman who worked as a teacher. Aisha was pregnant with her second child and excited about expanding her family. But from the beginning of her pregnancy, something felt off. She was experiencing severe headaches and swelling in her legs, symptoms that can be normal in pregnancy, but can also indicate more serious conditions. Aisha mentioned these symptoms at every prenatal checkup. Each time her concerns were downplayed. She was told it was normal, that she was probably just retaining water, that she should put her feet up and relax. But Aisha knew her body. She knew this wasn't normal for her. At 32 weeks pregnant, Aisha woke up with a splitting headache and blurred vision. She went to the emergency room where she was finally diagnosed with severe preeclampsia, a potentially life-threatening pregnancy complication. Despite the medical team's best efforts, Aisha suffered a stroke. She survived, but was left with permanent disabilities. Her baby was delivered early and spent weeks in the NICU. Aisha's story is heartbreaking, but unfortunately, it's not unique. It's a stark illustration of how the dismissal of Black women's health concerns can have devastating consequences. If Aisha's symptoms had been taken seriously earlier, if her doctors had listened to her when she said something wasn't right, her outcome might have been very different. These stories, Tasha's, Aisha's, and countless others, they're not just anecdotes. They're not isolated incidents. They're symptoms of a larger systemic problem, a problem that's costing lives, destroying families, and perpetuating cycles of inequality. But here's the thing, it doesn't have to be this way. We have the power to change this narrative. We have the ability to create a healthcare system that truly serves everyone, regardless of race or gender. We have the opportunity to build a future where a Black woman walking into a doctor's office feels just as heard, just as valued, just as cared for as anyone else. Imagine that future for a moment. Imagine a world where Tasha doesn't have to fight to be heard, where Aisha's concerns are taken seriously from the start. Imagine a healthcare system that recognizes and addresses the unique challenges faced by Black women, that actively works to eliminate disparities, that values every life equally. That future is possible, but it won't happen on its own. It requires action from all of us. It requires us to educate ourselves, to speak up, to advocate, to vote, to hold our institutions accountable. It requires us to be uncomfortable, to have difficult conversations, to challenge our own biases and those of others. As we come to the end of our time together, I want to leave you with a challenge. Think about how you can contribute to health equity in your community. Maybe it's by sharing what you've learned today. Maybe it's by supporting organizations working on this issue. Maybe it's by examining your own biases if you work in healthcare. Whatever it is, do something, because every action, no matter how small, can contribute to change. Remember, health equity for Black women isn't just a women's issue or a Black issue, it's a human rights issue. It's about creating a society where everyone, regardless of race or gender, has the opportunity to live a healthy life. It's about recognizing that when we lift up the most marginalized among us, we all rise. So let's commit to this fight. Let's commit to creating a healthcare system that truly serves everyone. Let's commit to a future where stories like Tasha's and Aisha's are the exception, not the rule. Let's commit to being the generation that finally closes the gap in health outcomes. Because in the end, health equity isn't just about fairness, it's about our shared humanity. It's about recognizing that every life has equal value, that every person deserves the chance to live their healthiest, fullest life. And until we achieve that, none of us can truly be healthy. So I ask you, what will you do today to contribute to health equity in your community? How will you use your voice, your influence, your power to make a difference? Will you speak up the next time you witness bias in action? Will you support policies that address healthcare disparities? Will you amplify the voices of Black women when they share their experiences? Your action, no matter how small, could be the start of a ripple effect that changes lives. So, what will your ripple be? The time for silence is over. The time for action is now. Let's work together to unmask this silent epidemic, to challenge the status quo, to demand better for Black women and for all of us. Because when we fight for health equity, we're not just fighting for better health care. We're fighting for a more just, more equitable, more humane society. And that, my friends, is a fight worth having, a fight we must win for Tasha, for Aisha, for every Black woman who has ever felt unheard or undervalued in a doctor's office, for all of us. Thank you for joining me on this journey. Now let's go out there and make some noise. Let's disrupt the system. Let's create the change we want to see, because the health of Black women isn't just a Black women's issue. It's everyone's issue. And it's time we all started acting like it. Together, we can build a healthier, more equitable world. A world where every life is valued, where every voice is heard, where every person has the opportunity to thrive. That's the world I want to live in. How about you? Let's make it happen. Starting now, starting with us. The future of healthcare equity is in our hands. What will we do with it?